America, the beautiful, green, and fertile, home to hundreds of diverse cultures and on the forefront of innovation. Our country is abundant in food, technology, and resources. Unfortunately, it is also abundant in highly volatile chemical facilities that threaten the lives of nearly 200 million Americans every day. Across America, over 12,000 high-risk chemical facilities clutter the landscape. Roughly 40% of the population live within 3 miles of facilities that are at constant risk of leaking or spilling toxic chemicals or exploding and destroying the communities around them. These areas are called Fenceline zones. It sounds crazy, right? To say that nearly 200 million people in America are placed in daily danger? Yeah, it's true. The EPA reports that from 2004 to 2013, there were over 2,200 fires, explosions, and chemical releases at RMP facilities, 1,500 of which caused reportable harm, including over $2 billion in property damage, the evacuation or shelter in place of 500,000 people, over 17,000 injuries, and 58 deaths. That's an average of 1 incident at a high-risk facility every other day in America. The people living in fence-line zones are disproportionately Black and Latino. The poverty rate in these communities is much higher than the rest of America. None of these people had a choice in allowing such dangerous facilities to be built, yet they are the ones that must live with the risks. These communities, living within the fence-line zones, are fighting every day for cleaner air and safer lives. In addition to the tangible dangers posed by leaks or explosions at high-risk facilities, there's also a complex web of factors that contributes to compromising the health of those living in fence-line zones. Exposure to air pollution leads to an increase in respiratory distress and illness. Breathing toxic air increases cancer risks. Most fence-line communities lack access to healthy groceries, relying on corner stores and dollar stores for most of their food. Studies have shown that higher poverty rates increase health risks. The constant stress of living with a possible chemical disaster impacts health even further. In addition, many fence-line zones are located in areas considered vulnerable to severe weather due to climate change, increasing the likelihood of a disaster significantly. Even if you don't directly live in a fence-line zone, there is a high chance your work, school, or hospital may be within one. 39% of hospitals and nursing homes in the U.S. fall within fence-line zones, placing sick and vulnerable people in harm's way, many of whom are not able to evacuate on their own when disasters occur. 45% of America's schools are within 3 miles of a high-risk facility, putting them within a fence-line zone. That's over 56,000 schools that are in immediate and serious danger in the event of a spill, leak, or explosion. When the West Texas fertilizer plant exploded one night in 2013, it damaged or destroyed 150 buildings. The blast obliterated the neighboring middle school. If the accident had happened on a school day, every student would have been in the fatal blast radius, and the death toll would have been astounding. All schools within the district closed while health hazards were assessed, disrupting the lives of students and their families for miles around. Everyone has a right to live, work, and raise their children without being in constant danger from toxic chemical pollution. There are many organizations and thousands of community leaders calling for change. Those living in fence-line zones are not silent. They are passionate and well-organized, working for change and fighting the companies that threaten their lives. Here's how you can support these community activists, share their campaigns, and donate to their causes.